Hey, Pro-Life Jen, it's Kristan Hawkins. Welcome to this new episode of the Explicitly Pro-Life podcast. Before we get started, I just want to give you a little warning. Stay tuned to the end of this episode, where I'm going to debut for the first time a brand new resource Students for Life will be offering for women across the country. So you're not going to want to miss this, so make sure you listen to the end. You know, there are countless abortion regret stories. And we know many women feel immediate regret after specifically swallowing chemical abortion pills. But did you know and are you aware that there is a way that we can reverse the effects of the chemical abortion pill to save the preborn child and even possibly save the life of the mother? Do you know about chemical abortion pill reversal? My guest today is the Dr. George Delgado. And if you didn't already know of him, he invented the abortion pill reversal, a program that connects women who have changed their minds after taking the first pill in RU486 chemical cocktail, mifepristone. And he has established a protocol that will actually reverse those effects. Abortion pill reversal seeks to refine and improve the treatment for reversing mifepristone. It's always changing. Dr. Delgado has received his medical degree from the University of California, Davis. He completed his residency at Santa Monica Hospital, UCLA. He's board certified in family medicine and in hospice and palliative medicine. He is clearly qualified to be having this discussion. And as you know, as with chemical abortions now taking up more than half of all abortions in our country, this is a conversation we must have. Dr. Delgado, thank you so much for joining me on the podcast today.
You're welcome. It's a pleasure to be with you and all of your listeners and viewers.
You have been on my list for such a long time to finally snag you on my podcast. I'm so excited. I have a lot of questions to ask you because I think, this conversation, particularly now with the fall of Roe versus Wade, with, surgical abortion facilities across the country shutting down, this is the abortion conversation that we have to be having is how do we stop? How do we prevent these dangerous chemical abortions from taking place across the country? So I guess the first question is, what led you to think or, first start having that thought that you could establish abortion pill reversal process?
Really, it was because of a woman who cried out for help. It was back in 2009. I was in my office seeing patients, and I got a phone call from a sidewalk counselor in Bakersfield, California, by the name of Terry Palmquist. Terry would carry a cell phone and had a website, so she would actually field calls from women all over the country to give them support and advice. That day, she happened to get a call from a woman in El Paso, Texas, who had taken mifepristone to start her chemical abortion, but changed her mind, and she wanted a second chance at choice. So Terry called me for advice, and I told her, well, Terry, I've never heard of anybody reversing or stopping a chemical abortion before, but let me just think about this for a minute. And I had a lot of experience using progesterone in pregnancy for women with low progesterone levels who are having cramping and spotting, something we call threatened miscarriage. And I had studied how mifepristone causes chemical abortion since even before it was approved in the year 2000. And I knew that it worked by blocking progesterone receptors. So you can think about mifepristone as being a false key that goes into the key lock, but doesn't turn the lock. And so therefore the door doesn't open. While progesterone is the true key and it goes into the lock, turns the lock, the door opens, what we call the hormone effect. So we don't want that false key in the lock because then it's blocking the effects of progesterone. Well, I figured that perhaps this was a situation analogous to a woman with low progesterone levels. These are women whose progesterone levels were essentially blocked. So I thought perhaps we could supplement progesterone levels to outcompete those false keys at the receptor level until the mifepristone washed out of the system. So I had that idea. Next thing I did was I found a doctor in El Paso, Texas, Dr. Jonalyn Bellacura, who could help this woman who had experience using progesterone in pregnancy. She agreed, and I drew up a protocol right there on the fly. Dr. Bellacura agreed to use that protocol, and she treated the patient. And then that was that for that day. And Several weeks later, I got a message from Dr. Bellacura that the baby was still alive. So I thought, boy, isn't that wonderful? I didn't know if it was really something that would be useful for other women because I didn't know if it would just happen by chance. But then I found out later that there was another doctor, Dr. Matthew Harrison, who about a year and a half before me actually had done the very same thing in North Carolina, unbeknownst to me. And then we started hearing about other cases, and eventually I had collected several cases, and people were calling me from all over the country asking for advice. And from there, things had developed, and eventually I started the Abortion Pill Reversal Network.
That's amazing. I think to back it up for viewers who haven't watched like my a bajillion episodes about chemical abortion on the podcast, chemical abortion right now in the country is a 2-pill regimen. Mifepristone is the chemical we've been talking about a lot. That there's been the Fifth Circuit has stated decision by a Texas judge said it should never been approved. The FDA used basically an age protocol to speed it through the approval process and didn't actually fully study mifepristone. But mifepristone is that first pill that you're talking about, Dr. Delgado, that blocks progesterone. And then the second pill is mifepristol, which then induces the contraction. So for abortion pill reversal process to work, you have to reach her, or she's got to contact you all before she takes that second pill, right?
That's correct. There's a window of opportunity between the two drugs. So we can reverse mifepristone. We don't have a way at this point to reverse misoprostol. So it's that window of
Okay.
opportunity before she's taken the second drug. And that's when many women have second thoughts and have misgivings almost right away. And so they generally call us. And these days, most women get started on progesterone within 24 hours of taking mifepristone, the first drug.
Wow. That's unbelievable. Can you, just for maybe some of our viewers who haven't been pregnant before, what does progesterone do for the baby? Why is it so important in pregnancy?
Yeah, so progesterone is essential for pregnancy, and there are rabbit models where they took out the ovaries of rabbits that were pregnant, and all of them had miscarriages. And we know that women who have low progesterone levels commonly miscarry.
Hmm.
So, and the name itself is an acronym for progestational steroid kinone. So it actually means progestation for the pregnancy. And this is really a magnificent hormone that any woman who is ovulating will produce progesterone in large amounts in the second part of her cycle. And then that's what causes women, for example, to have tender breasts in the second part of the cycle before the period starts or when the early part of the pregnancy. And progesterone does some very, very important things. The first thing it does, even before the woman is pregnant, it actually prepares the lining of the uterus so that it's thick and luxuriant,
Hmm.
so that the 5 to 7 day human embryo coming down the fallopian tube can implant in a very, very early pregnancy. Second thing it does is it causes a development of and sustains the maternal part of the placenta. Now, the most of the placenta comes from the preborn baby, from the embryo. However, there's a very thin layer that comes from the mother that called the maternal layer, called the decidua basalis. Now, that very thin layer is essential for the placenta to adhere to the wall of the uterus. And that adherence, that super glue, is very important because the placenta, of course, is how the baby gets hydration, nutrition, and oxygen from the mother and sends his or her waste products back to the mother for exit. And if that decidua basalis, the maternal part of the placenta, is not being sustained by progesterone, what happens? Well, the placenta separates, and that's what leads to the death of the preborn baby. Progesterone does other things
Wow.
too. It causes the uterine muscle to stay nice and soft and relaxed. It inhibits contractions because during the pregnancy, you don't want contractions, right? You want the uterus to be very soft. You want it to stretch to accommodate the growing baby. The progesterone also keeps the cervix closed nice and tightly like a biologic valve because you want the outside world to be totally separate from the inside world. The
Hmm.
progesterone does also some wonderful things in the breast. We talked about the breast tenderness due to progesterone. That's because the progesterone is causing development of breast tissue. It causes the lobules of the breast to go from immature to mature lobules so that they're ready to produce milk. But at the same time, it inhibits milk production because, of course, you don't want milk to be produced during the pregnancy. But the breast lobules are right at the starting line, but don't cross that starting line. Then at the time of delivery, progesterone levels falls. And what happens? Then the mother starts making milk. The uterus starts to get
Mm.
twitchy, starts to contract, and the cervix starts to open.
Wow. Didn't know all that, and I've had 4 children, so that was extremely helpful definition of just how important, that hormone is, and I think it just shows you how evil mifepristone is, and the development of mifepristone to stop, to inhibit, um, progesterone from even being developed. It's absolutely evil. How do how do you how do people get in touch with the Abortion Pill Reversal Network? Is it simply pro-life sidewalk counselors, pregnancy centers, groups like ours and other pro-life groups just advertising the Abortion Pill Reversal Network? Is that how mainly folks get in touch with you?
That's part of it. But you really, the most common way is like young people often do these days when they want information. They go on their smartphones. So women will commonly go on the smartphone, type into a browser, I want to stop my abortion. I regret my abortion. I want to reverse my abortion,
Mm,
something like that. And then generally from there, they're led to the website
mm,
abortionpillreversal.com. There they go on that website, which has great information. In fact, the information there on the chemical abortion itself is probably better, more detailed information than you would find on Planned Parenthood's website from my comparison. So they can actually learn a lot more about what they've already taken than they learned at the abortion center. Second, that has great information on abortion reversal and all that goes into it. Then the website also has a chat feature so she can start chatting with an operator who can answer any questions. Then, if she has had all of her questions answered and she wants to proceed, she's connected to a highly trained nurse who's on the Abortion Pill Reversal Network, who then will get more information from her, then confirm that she wants to reverse her medical abortion. Then we'll connect her with a clinic or a doctor in her area who is competent, caring, and willing to help her.
that's incredible. Do you know how many women have contacted you and how many lives have been saved through this protocol?
So we don't know all the lives have been saved by abortion pill reversal, of course, because not all of them have gone through the network. But of the ones that have gone through the network and the network has been able to keep track of, now have been documented more than 4,500 preborn babies' lives saved by abortion pill reversal. And women have
That's
been helped in
incredible.
all 50 states and in more than 70 countries.
That's a pretty cool legacy, doctor, that you can say you were part of, starting a process that that there's 4,500 little human beings, not so little now if you started in 2009, who are walking on this earth. That's pretty cool. That's pretty hard to top. Um, okay, so I mean, so this is working. What's the percentage, I guess, of success that you're seeing?
So, with our best protocols, what we call our high dose oral protocols, our studies have shown that the success rate at reversal is 68%.
That's even higher than I thought. That's awesome. Is this painful to do? One of the criticisms I've seen from the left, and I want to get into that next, about abortion pill reversal, is that it shouldn't be legal because it's harmful to women. But I'm like, wait a minute, you're the one giving her drugs that's literally stopping a natural function of her body. But is it dangerous for the abortion pill reversal process?
It's not dangerous at all. In fact, there is no evidence whatsoever in any research studies showing that abortion pill reversal carries any danger. And our studies have shown that the birth defect rate is about the same as the general population. Therefore, it does not increase the risk of birth defects. And the preterm birth rate actually is lower than the general population, 2.7% versus 10% in the US. Now, there was
Wow.
a study published in the year 2020 by Dr. Mitchell Crennan, which was stopped early ostensibly because of safety reasons. And this is a study that's commonly quoted when people say that abortion pill reversal is, quote, unsafe. However, these people either have not read the study, or misinterpreting the study, or just misstating the facts. Because if you actually read the study itself, you'll see that Dr. Crennan himself in the study writes that the side effects of progesterone were no different than placebo. And what is placebo? Placebo is a simple sugar pill. It's when you have a study where
Yeah.
you have a dummy pill, something they don't take anything or they take a pill that doesn't have anything in it in order to compare the active ingredient. So he said that the progesterone side effects were no greater than placebo. Later on in the study, we also read that he wrote that taking mifepristone by itself may be dangerous and cause bleeding. So he didn't say that taking mifepristone followed by progesterone. He said taking mifepristone by itself may cause bleeding.
Mm.
And his study was stopped early because of 3 patients who called 911. One of them was in the group that received progesterone. And that woman, when she got to the emergency department, the study said she needed, quote, no further intervention, unquote. What that means is that she didn't need to be in the emergency department. She had heavy bleeding with a chemical abortion like many women do. She probably got nervous and panicked, and so she called 911, but she really didn't need to be there. Now, 2 other women called 911. They were both in the placebo group. That is, they did not get progesterone. They only got mifepristone. Both of those women needed emergency suction abortions, and one of them needed blood transfusions. So really what the Crennan study showed was that taking mifepristone and not doing anything else could be dangerous, but taking progesterone after mifepristone was not shown to be dangerous. And in fact, the success rates in his study with the pregnancies that continued up to 2 weeks were much higher in the progesterone group, 68% in the progesterone group, as opposed to 30% in the placebo group. So those numbers also supported what we're saying, that abortion pill reversal is both safe and effective.
Okay, this is literally the opposite of what legislators in Colorado have been saying. So, Colorado just passed a law. It's not passed a bill, and then the governor promptly signed it into a law that threatens to take away anyone's medical license in Colorado who, commits and engages in an abortion pill reversal process. I don't even think you could. I don't even know if you're allowed to talk about. I think originally when the bill was introduced, it said you weren't even allowed to advertise it, and we were like, "What the heck?" We advertise Abortion Pill Reversal Network all the time in our things in our communication with our Abortion Free Cities program and Students for Life groups, and I think they removed that out of the bill. But one of the all the news articles that I was reading about the Colorado law is they are saying the reason they passed this bill and it had to be passed was to protect women from the dangerous results of the extra progesterone, and you're saying there's no studies that prove that.
That's correct. And I testified before the committee that was hearing that bill in Colorado, and I told them the same thing. Unfortunately, they chose not to believe the science and instead voted along ideologic lines. And this is the first time I've ever seen that a government body has passed a law to sanction physicians who are trying to save lives. It's totally turning good into
Yeah.
evil and evil into good, turning
Yeah.
reality upside down on its head.
Well, I mean, the basic question is, what about a woman's right to choose? If a woman chooses in the middle of an abortion not to have the abortion anymore, who are they to stop her? Because isn't it her choice? It's her body. That's why that doesn't make sense to me. And when you look at all the research that's out there, especially the overseas research about the dangers of chemical abortion pills to women, her future fertility, her health, her emotional well-being versus the abortion pill reversal process, which there's no studies out there that says that it harms women. It's clearly one side. It's unbelievable what they did in Colorado. How do you anticipate other states are going to try to do what Colorado did?
I'm concerned that they will, because often these liberal leaning states will play copycat. They'll see if one law passes and is
Hmm.
upheld, and then they'll do the same. And they often have what's called so-called model legislation, where they just use the same template and don't really rewrite the laws and just copy it.
Yeah.
So I am concerned that this may be copied by other states. However, I am also confident that the courts will eventually strike down this law
Yeah.
because it is unconstitutional. It is something that strikes at the very fiber of American values, which is supporting innocent life. And it also
Yeah.
is a unfair legislation of good medical practice.
I mean, what does this do for women who are having wanted pregnancies, haven't gone in for an abortion, but have low levels of progesterone, who then need the same protocol as abortion pill reversal, they need a high levels of progesterone and into their body to save their babies. Is that something going to ban those women?
Well, the way the law is written, it would not. But again, you never know if you could get on a slippery slope, and you never know when you get
Yeah,
overzealous Soros-backed DAs who prosecute things that
that's
shouldn't be
right.
prosecuted. It's just becoming the wild, wild west out there, unfortunately.
Yeah, I mean, the Soros-backed DAs won't prosecute violent crimes or thefts or criminals in our cities, but now they're going to come after pregnancy centers who talk about the abortion pill reversal process and doctors who want to preserve life. Yeah, got it. Okay, so I want to end this traditional part of the podcast to go to something. While I have you here and you're such an expert in this field, I wanted to play for you 4 different TikTok videos that our staff found about this concept that women need abortions. Because we've heard it more and more. I think we're going to continue to hear it. This drumbeat going of because there are high risk pregnancies. There's dangerous situations that occur in pregnancy. Therefore, we have to legalize all abortions, no matter what the circumstances, because of these situations. So I wanted to play for you some of these TikToks and have you react. Is that okay?
Sure.
I'm sure you've heard by now that in Texas, a woman was forced to give birth to a baby despite doctors being able to tell at 20 weeks that if the baby lived at all, it would only live for a very short, painful time. Samantha Castellano is 29 years old, and she and her husband have 5 living children. And in December, she was 20 weeks pregnant. She was told at that point that her baby had a condition called anencephaly, where the brain and skull don't completely develop, and she was told that her baby would be incompatible with life. Now, before Roe v. Wade was overturned and Texas's trigger laws kicked in, the doctor would have recommended Samantha get an abortion immediately.
Just to back that up, is that true that a woman who is shown that her child she's carrying has anencephaly that she's immediately has to have an abortion?
No, that's not true at all. In fact, in my work in perinatal hospice, I've taken care of many patients and their mothers who, where the babies had anencephaly, and they've gone to term and delivered. And in fact, I myself, when I used to deliver babies, I delivered a baby with anencephaly. And um, contrary to what this TikTok influencer is saying, these babies are not undergoing pain during the pregnancy. There's no evidence whatsoever that babies with anencephaly will feel more pain than any other baby during pregnancy. And if it's a pregnancy that's not being invaded by an abortionist, there should be no pain at all. And after the delivery, the baby is not having any pain. If the baby should have pain or trouble breathing, then we have the modern methods of perinatal hospice at our disposal where we can keep the baby very comfortable. There should be no reason at all for the baby to suffer. So to give this dichotomous situation where either baby suffers or you kill it is just very false. You
Hmm.
should never have to kill any patient, whether it's preborn or after the baby's born, or whether it's an elderly, frail person at the end of life. You should never have that decision to have to, quote, kill the person to decrease the suffering. Not at all. We can always treat pain and other types of physical suffering with our modern methods of hospice and palliative care. So, absolutely false everything she's saying. And a woman does not have to decide to abort her baby. In fact, studies in perinatal hospice with babies with severe defects show that the women who chose to have perinatal hospice and take their babies to delivery had much better psychosocial outcomes than the mothers who chose to abort. So it's actually
Hmm.
contrary to everything she's saying. The other thing I take issue is with the tag that's often used, quote, incompatible with life. That really doesn't make a lot of sense because if the preborn baby is alive, then obviously he or she is compatible with life because he or she is living at that moment. And so just because you have a chronic or and possibly terminal disease doesn't mean you're incompatible with life. For example, if I had stage 4 pancreatic cancer and I had 6 months or less to live, you wouldn't say that I was incompatible with life. No, you would say that I had a terminal illness. And so these babies with
Hmm.
anencephaly, likewise, they have terminal illnesses, but we still treat people with terminal illnesses with respect and dignity. We treat their symptoms. We don't kill them to eliminate any symptoms.
That's right. I don't think I have to play any more of that because you just ranked it false. let's get on the second one.
I'm not really representing anyone, just, a regular girl who's lived in North Carolina their entire life. My main point is here, I'm going to say first, is that abortion is complicated and can't be legislated like this. And I'm going to start by saying my story, and I'm going to speak quickly. I have bipolar disorder, and I've been dealing with suicidal ideation for 13 years. I finally found a medication that works for me called lamotrigine, but unfortunately, it makes birth control ineffective, and birth control makes lamotrigine ineffective. On top of that, I have a unicornuate uterus, which means I do not qualify for an IUD, and I can't get sterilized because no doctor will sterilize me as an unmarried 26-year-old woman. So my only option for birth control is condoms, which have an 87% effective rate. If we apply that statistic to North Carolina women of childbearing age, that's 300,000 women who would be forced to carry to term if they just use condoms as a perfectly acceptable form of birth control. On top of all that, I have PCOS that affects 1 in 10 women. And I don't get a period every month. I don't get a period every 3 months. I could easily find out that I'm pregnant outside of that 12-week window. And to be honest with you, if I found out I was pregnant at my lowest, I would kill myself. I don't want to be inflammatory, that's just the truth. But I'll end with this. The Founding Fathers included 3 words in the Declaration of Independence when they rose up against a tyrannical government who controlled them. Those words were life, liberty, and the pursuit of happiness. They included those 3 words for a reason.
Okay, well, obviously she does understand that the reason the Founding Fathers did those words in the way they did, life, liberty, and pursuit of happiness, is because, the right to life is very fundamental. And that should actually come before upholding liberty and upholding pursuit of happiness, and that you have to have the right to life in order to be able to pursue and have liberty and pursue happiness. Beyond that, doctor, we got a lot of things. We got unicorn uterus, which is a word I've never heard before, PCOS, which is very common, very painful, and then also bipolar disorder with a medicine that makes birth control ineffective. How do you respond?
Well, I think she meant bicornuate uterus, and the uterus of a human normally is sort of just a round structure. However, some women have abnormal development where it kind of becomes heart-shaped, and so the tubes come in and form large parts of the uterus, and then there's a kind of an indentation. And so those women are at increased risk of miscarriage, and it can be difficult to use IUDs, like she said. So it is a certain complication. And you probably all know what polycystic ovarian disease is, where she has abnormal hormone levels, increased levels of usually of male hormones and irregular cycles. And oftentimes, actually, women with PCOS have infertility, so they're less likely to get pregnant. And then on top of that, she says she has bipolar disorder. So this woman, of course, has some unfortunate circumstances. But there are a couple of things. I think you hit on the key one, which is life really is the most important right that we have. It's important to know that the life of one person is not of greater value than the life of another person. And I think our founding fathers implied that when they wrote this. And so therefore, just like a woman who's pregnant, the life of the preborn baby is equal to the life of the mother's life is equal to her. Her life is not of greater value.
Right.
The preborn baby's life is not of greater value. We have to always keep that foremost in our minds. So we have had women who, with mental illness and on supposedly dangerous medications, get pregnant all the time, because women get pregnant in various circumstances. And so we do what's best for both the mother and the baby. And it's unfortunate that she's somewhat trying to hold society hostage by saying, well, if I get pregnant, I'm going to commit suicide. That is somewhat a disingenuous type of an argument that really, I think, tugs at people's heartstrings, but also is just really manipulative. And so, although she does have some very trying circumstances, we really shouldn't capitulate to that kind of argument and change our laws, which govern all people with medical problems and without medical problems, just because we have a woman who's saying she'll commit suicide if she gets pregnant. So I think it's important that we do value her life. And if she is suicidal, we should give her all the support and the help that she needs, so that she doesn't feel that she has to take her own life and keep her safe. But at the same time, we have to keep any future preborn babies in her womb or in the wombs of other women safe, because that's what a civil society does. It protects the least of our brothers and sisters. And really, the least of our brothers and sisters are those who can't defend themselves, who have no voices. Those are the preborn. And so we protect and we defend them. We also protect and defend their mothers.
That's right. And yeah, it's interesting because I don't think anywhere in that whole conversation, you don't actually have to have sex. Like if you're taking this bipolar medicine, if you can't get an IUD, which is also abortifacient, if you want to be sterilized and can't find a doctor who will sterilize you, like you don't actually have to have sex either. I think that's something that's also missing in this conversation. Um, is this thing of I have to have sex. Um, yeah, it's crazy. Okay, so let me play for you. I got 2 more to go.
We train for years and years to be able to look at the person in front of us and to make the best healthcare decisions with them and their families. And we're seeing that many people with high-risk pregnancies are not able to get the abortion care that they need. You've heard a couple examples of people that break their water before the baby's able to survive outside of them. I also take care of people with medical conditions like really high blood pressure, where continuing the pregnancy puts them at risk for things like stroke and preeclampsia. We see people with peripartum cardiomyopathy, where the pregnancy causes their heart to enlarge and weaken, and the risk of having that happen again in another pregnancy is quite high. For all of these people, we're having to ask ourselves, how sick do they have to get to be able to intervene?
Okay, so I'm gonna stop that there. So she talked about high blood pressure, women, not people, women's whose water break, and then cardiomyopathy. I think I maybe have gotten that wrong. Is abortion a solution to those 3 circumstances that happen during pregnancy?
Absolutely not. I've never seen a medical condition where abortion was, quote, required. Absolutely not. In all of these situations, a woman can be aggressively treated for her condition, and she can be safely monitored through her pregnancy. It doesn't mean she will have a normal risk pregnancy. She'll still have a high risk pregnancy, but the risk of having an abortion is going to be higher for her than carrying her pregnancy to term. And of course, the abortion will end the life of the preborn baby. Now, it's important to realize also that all of the laws that are banning abortion in certain pro-life states, all of the laws so far have specifically stated that they do not ban treatment that's rational and that's accepted medical treatment for things like tubal pregnancies. Okay, so treating a tubal pregnancy, for example, is not an abortion. Treating a woman who's had a miscarriage and the baby's already dead is not an abortion. Treating a woman who has an infected uterus, where the treatment there is evacuation of the uterus to take out the affected placenta, is not an abortion. So it's important to realize all that their rhetoric is to try to confuse people. And none of these laws and no pro-life doctors want to keep women from getting necessary medical treatment. What we're saying is that abortion, the direct action of killing a preborn baby, an innocent preborn baby, is never justified, and it's never needed medically to treat any of these complicated medical conditions. These conditions can still be treated aggressively, and sometimes we treat them aggressively. We know that it may be putting the preborn baby at risk, but that's a risk we accept because, again, we're treating 2 patients, the mother and the baby. And in no way do these laws keep women from getting the necessary treatment they need for their high-risk pregnancies.
If a mother can no longer, like, say she's becoming preeclamptic or whatever, if you have have you ever had a circumstance where a mother can no longer be pregnant? Like, just she's 26, 27 weeks, can no longer be pregnant. Have you ever had that situation happen before?
I have not had that personally, but I have known of cases where women, let's say 26, 27 weeks, where the preeclampsia or eclampsia is getting so dangerous that it's a danger to both her health and the baby's health. And then the baby then is delivered early in order to.
But wouldn't it be
save the
better
life of
just to insert digoxin into the baby's heart and cause a cardiac arrest, than 2 days later deliver a dead baby?
So that would not be justifiable, and that would not be in the best interest of the mother. The best interest of the mother is to deliver the healthy baby alive and then you take care of the mother, then you've taken care of the mother's preeclampsia, and then the baby, of course, goes to the intensive care unit and gets our modern
Yep.
intensive care, neonatal intensive care, and baby at those ages generally do fine. So there just are not any cases you could come up with where a woman had to have an abortion as the best treatment for
Yeah.
her complicated pregnancy.
Yeah, I ask that with students all the time. I say, if a woman has whatever complication you're cooking up or story you've heard, is there's no complication that she could have that could say, yes, let's insert a toxin into a child's body that causes cardiac arrest, then insert Lumeria into her cervix to ripen her cervix, and then deliver a dead baby 2 days later. I mean, that's like a 2 to 3 day process where if she can no longer remain pregnant, the obvious solution is just deliver a child, do a C-section. It's so backwards, this thinking of like we have to wait 3 days to like make sure the baby's dead and then deliver it. It doesn't make any sense to me, and I don't think it makes sense to students once they figure out either. Okay, one more video for you.
In Oklahoma, a woman was told to wait until she was crashing for abortion care. JC Staton was diagnosed with a molar pregnancy. And in case you didn't know, molar pregnancies will never become a baby, but they are cancerous. And when JC tried to get care, staff told her and her husband that she could not get a surgical abortion until she became much sicker. They said the best that we can tell you to do is sit in the parking lot, and if anything else happens, we will be ready to help you. But we can't help you unless you are crashing in front of us. Because Oklahoma has 3 different overlapping abortion bans with different and sometimes contradictory definitions and exceptions.
Okay, can you explain what a molar pregnancy is and what you think happened here in this video?
Sure. So a molar pregnancy is when the sperm and the egg, we think they do unite, but instead of producing a new person, this produces an abnormal tissue growth that's predominantly what we call the chorion. The chorion is the part of the preborn of the embryo, the preborn embryo, that goes on to become the placenta. So early on, it's really part and parcel of the embryo, but then later, of course, it's a separate structure, and once the baby's delivered, it's essentially discarded. Well, if you have this chorion growing out of control and no baby there, then essentially what you'd have is a tumor inside the uterus. And sometimes the molar pregnancy can become cancerous, not always. So there's an error there in that they're not always cancerous, but they can become cancerous. But it is something that does need to be treated. And evacuating the uterus of a molar pregnancy is not an abortion because it's not the direct killing of a preborn human being. So we don't know the real facts of the story because sometimes on these clips, the facts are distorted or not completely presented. But if what she's saying is correct, then my interpretation is that the laws were misinterpreted, and the fanaticism and the fear being promoted by these pro-abortion forces is leading people to make very poor decisions and poor interpretation of the law. So a doctor who knew the law and was compassionate would have said, no, this is not an abortion. You need treatment for a molar pregnancy, which is evacuation of the uterus, but is not a direct killing of a preborn baby because there's no preborn baby in there. So it's again, these are the kinds of stories that are used to stoke fear and to try to change public opinion, but in fact, it's all based on falsehoods.
Yeah, I mean, this is exactly how the abortion lobby, if you go back and look in the 1960s, how did the abortion lobby change mainstream America's mind on abortion? They used the story of the woman in Arizona, the child's TV host who was in a marriage, a good marriage, had children, took a drug that thalidomide that led to birth defects, and then she wanted to have an abortion, and the hospital there in Arizona wouldn't give her an abortion. And she flew overseas. And that was one of the main stories when you look back in the 1960s for how did, this concept of legalizing abortion become popular was the abortion lobby used the story of one woman, making the exception the rule. And I think that's exactly what we're seeing now, Dr. Delgado. Thank you so much for responding to these TikTok videos. It's almost like, I hate to say this, but I almost feel like abortion lobby is like championing and hoping to find a tragic story. They're hoping to find a story of a woman who was diagnosed with a high-risk pregnancy or something that went on in her pregnancy, and a doctor who either rightly, followed the law or maybe didn't follow the law or didn't really know the law, and to use that story just like they did in Ireland to legalize abortion not long ago, to use it to try to reverse cultural opinion on abortion. I think that's
Yes,
a very
abortion lobby.
scary situation.
Yes, everything they do is built on putting fear in women's hearts, and that's what leads them to get abortion, but also putting fear in the hearts of the American public so that public sentiment will shift towards them. And if you go
That's
back
right.
to when abortion was first approved in the United States, Dr. Bernard Nathanson, formerly, he was one of the
Yep.
founders of NARAL, and later and aborted tens of thousands of
Okay.
babies, later became pro-life, of course. He admitted that when they were quoting this number of, quote, back alley abortions, that they picked that number out of thin air. They made it up, and people believed them. They believed the big lie. It was a made up number.
Yep.
They're making up things now again. That's how they do it. They make up,
Yep.
they tell lies, they stoke fear.
Yep. And that's why I wanted you to come on today to kind of give us some truth and some facts here, because this is really what we're called to do as pro-life advocates. Like, we have to call out this misinformation, say, wait, back it up here. You're telling me that a woman who's dying has to go through a 3-day abortion procedure? How does that help her? I think you've got to start asking these questions, guys, online in your conversations, because we've got to be rebutting this misinformation, this fear that they're stoking in the hearts of especially American young women. Dr. Delgado, thank you so much for coming on. I want to give a plug for your all's website, abortionpillreversal.com. This is a website you all need to memorize. Get a bumper sticker, put it on your car. I need a laptop sticker. I don't have one. I mean, put it everywhere, because as I mentioned earlier, this is a leading cause of abortion now in the United States. And so we've got to be talking about the abortion pill reversal process. It's abortionpillreversal.com. How else can folks get in touch with you, doctor?
They can also visit the Steno Institute website. That's the nonprofit that's I set up to increase awareness, education, and research around abortion pill reversal. And that's stenoinstitute.org, STENO institute.org. You'll get a lot of great information there and videos, and I'd be happy to post this one on there once I get it.
Thank you so much for coming on. Thank you for the incredible work, the lives you saved, the mothers you saved. It's such an honor to have you on today on the Explicitly Pro-Life podcast. And for you all who stuck around to this entire episode, which was amazing, by the way, I hope you were taking notes. I had to resist taking notes myself because it would have been too loud here. I want to tell you about this new resource Students for Life America, our Standing With You team, has just released. It's called pregnancy.emergency.com.org. Pregnancy.emergency.com.org. We want to connect women who are facing pregnancy emergencies with doctors who want to help her and her child survive and thrive. And so if you know of a situation, a young woman, a mother who's facing complications especially late in pregnancy, who's being told she has to have an abortion in order to save her life, she's concerned about her life, have her go to pregnancy.emergency.com.org, where we can help connect her with pro-life OBGYNs in her neighborhood, in her area, who can serve her and who can serve her in a life-affirming way, caring for both patients, both mother and child. I am so excited for this resource. It's much needed in the pro-life movement. We're so honored to be partnering with our friends at Heartbeat and APLOG, American Association of Pro-Life GYNs, to bring this resource to you. So remember this website too, abortionpillreversal.com.org, pregnancy.emergency.com.org, and make sure you like and share this episode all over the internet. We've got to get Dr. Delgado's amazing life's mission and work out to all of America and spread the word. The abortion pill reversal is possible. It does save lives. And yeah, by the way, chemical abortion is really bad for women and babies. Next time, guys. See ya.